has been feeling unwell and warm the past 3 days. It's mid-afternoon and he's lying in his bed, which is unusual behavior for him. You ask if he's ready for hockey practice, and he responds that he has a headache and his neck is sore. He then shows you the rash he found on his legs. You become very worried about Jake. Are his symptoms related to meningitis? This prompts you to take him to the closest emergency department. After checking Jake and giving him an oral medication for the pain, the medical team is also concerned about the possibility of meningitis and are thankful you brought him in. Although this word may be scary, it's important to remember that you have an experienced team of healthcare professionals who can help Jake. What should you expect next? Meningitis is the medical term for inflammation or swelling of the tissues that surround the brain and spinal cord. These tissues are called the meninges. This swelling can be caused by bacteria or a virus that has come from another location in the body. Viral meningitis is more common than bacterial meningitis. Bacterial meningitis is not as common, but is often more severe than viral meningitis. Meningitis can only be diagnosed by collecting a small sample of spinal fluid through a procedure called a lumbar puncture. This test is obtained by inserting a needle into the area between the bones in the spine. Healthcare professionals will attempt to decrease Jake's pain by placing numbing cream on the area of his back where the sample will be collected. Jake will also be offered medication to make him more comfortable and less anxious. These types of medications can be given through the nose, through a vein, or by an injection into a muscle. They're chosen because they act quickly and can have minor side effects that your healthcare professional will discuss with you. If Jake were a small baby, he may be given a high concentration of sugar on a soother, which has proven to ease pain in small infants. You will notice that the physician needs to position Jake in a specific way for this test, and that he will be asked to stay still. This is an important step in helping to collect the sample. The lab results from the lumbar puncture will come back in 2 phases. The first results give early information about how likely a meningitis infection is. The final results need specialized testing and will take about 48 hours to come back. This test can be difficult, and if the doctor is not able to get the sample, treating Jake with the appropriate medication as soon as possible is the most important next step. Jake will be given medication that treats the most common causes of meningitis. As Jake's results from the lumbar puncture come back, they will hopefully show the specific bacteria or virus that is causing him to be sick. Based on this result, the healthcare team may adjust treatment and change the antibiotics. Jake will be closely monitored in the hospital so that nurses and doctors can help if his condition gets worse. Jake's caregiver can stay with him while he is in hospital and will be asked to tell a healthcare professional if his condition changes or gets worse, such as not responding normally, difficulty waking up, or any other changes. If your child has been diagnosed with meningitis, be sure to let your healthcare team know if you have any other children or adults at home or friends or family that have been in close contact with your child. They may need close symptom monitoring and/or preventative treatment. Although your child or others may have had the meningitis vaccine, this does not prevent all types of meningitis. The treatment and long-term outlook after being diagnosed with meningitis can be very different depending on the cause. Early recognition and treatment are very important. Remember, you did nothing to cause this. We are here to support you and your child, so please do not hesitate to ask questions throughout your stay.